Hey friends, welcome to Ask Nurse Alice, the show that talks about all things health, wellness, love, lifestyle, and we bring you all the tea with no copay. So shout out to my friends at Exclusive Media. They are the powerhouse behind production, so thank you to them. Follow them on social media, and as well, go to your favorite podcast network and make sure you look for Ask Nurse Alice and subscribe, like, follow, write a review, all of those great things. And you know what? Share it with a buddy, because sharing is caring. And speaking of caring and sharing, because I care about you all and I want to share all this great information with you all. Obviously, many of us are still kind of quarantined at home. This is kind of a new normal. We're still trying to figure this out, while still wanting to kind of open the economy, get our kids back to school and a bunch of other things, right? We want to do it safely. But one of the things, in addition to wearing masks, hand washing, social distancing, and all those good things, is making sure that we take care of ourselves. So many people have, they're trying, dibbling and dabbling in a whole bunch of different things to try to boost their immune system. So you know what, guys? I didn't have to dig too deep, because I just knew right away who the perfect person to bring on the show would be. And you guys, I am bringing one of my super friends. I'm bringing Dr. Sam Price. She is a world-class expert in natural medicine. She is a licensed concierge naturopathic physician. I mean, she's also the chief medical officer for Balanced Integration. And she does so many things. She's so knowledgeable. We could do the whole show with just her introductions, and we wouldn't even, before even getting to our first speaking point. But you know what? I want to get into it. So you guys, please welcome to the show, Dr. Sam. Hey, Dr. Sam, how are you?
Hey, Nurse Alice. Thank you so much for having me. I am so humbled and blessed to be on here. I'm so excited to share with your audience all the things about what you can do for self-care. This is my passion.
Mm-hmm. Of course. Listen, I knew it was your passion. I was like, listen, I know we got the right person. And guys, I mean, we're having this initial podcast, but of course we're going to bring her on as often as we can. She has books, products, services, and a whole bunch of other things that we'll get into, because as we are identifying issues, we are going to bring you solutions, provide you tips, and get the best advice from Dr. Sam. So Dr. Sam, if I may, you're a naturopathic physician or naturopathic doctor. Could you please explain to some of the viewers and the listeners who might say, she's a doctor, but I don't really know what naturopathic is, and how's that different from my regular medical doctor or primary care doctor that I see on the regular basis? So can you first start with a little bit of that so we can better understand?
Absolutely. So a naturopathic physician actually is a physician, board certified and licensed, that's actually considered an expert in natural medicine. That is our specialty, is natural medicine. So if I may, if you don't mind, I'll just tell you a little bit of the difference in the education part of it. Is that okay?
Yes, that's what we want to know.
Perfect. So just like we go to college, your MD, your DO would go to college. Yes, we go to college. Then we will progress on to medical school. In medical school, we do the same first 2 years of training, anatomy lab, biochem, all that good stuff. Our going into our third year is kind of where we separate. So we take a licensing exam. Well, it's a board exam called the Naturopathic Physician's Licensing Exam, Basic Sciences, after the second year. I think that's analogous to your USMLE Step 1. It's basically making sure that we understand the basic sciences in the first 2 years of our training. The third year is where we start shadowing other doctors, or what we call that internship year. We're not really practicing, but we're learning what it's like to be with patients. It's also where we start differing in our training, where we start learning homeopathy, nutrition, botanicals, acupuncture, all the natural therapies. I do want to make sure that you guys understand that we are also trained in pharmaceuticals, because many patients come to us and they want to get off of their pharmaceutical or their medications. We have to understand the mechanism of action as well. So yes, we do take those foundations as well. So after our fourth year of school, just like a regular medical school, we also take board exams. So this would be analogous to USMLE Step 2, 3, or 4, where we're taking clinical sciences. And this is the licensing exam that we have to have in order to say that we're board certified and licensed to practice medicine, just like an MD or a DO. There are schools out there where they say that they're giving a doctorate of naturopathic medicine, but that is not true. There are only 7 schools in the USA that are licensed by the U.S. Department of Education under the Council of Naturopathic Medical Education that can give the degree of a doctor of naturopathic medicine. So my degree is an NMD, a naturopathic medical doctor. Okay. And there's only 7 schools that give that. So you need to really be careful when someone says that they are a naturopathic doctor or physician. Question what school they went to. Did they take board exams? Because that's going to distinguish whether or not they have the clinical know-how, right, of how to treat you and what's safe and not safe. So that's really key when you're looking for a naturopathic physician.
So that's great. Thank you for breaking that down for us. So not only is it good for us to know that as potential patients who are seeking this treatment, but also for people who might, especially our young folks and maybe not so young, who are interested in following that pathway to becoming a naturopathic physician. So that was good stuff. Now, so as someone who's coming as a patient, I have, I usually go in for my regular wellness appointment, my well woman stuff. Is that something that I can go to you for as well? Or is seeing someone like you complementary to my traditional medical physician? And let me just say this. I don't want to just take pills. I don't want to just get a radiology test and some labs. I want to, really focus on my wellness, but outside of pills, diet, eat healthier and exercise daily. Those are like the 3 main things. I want more than that. So I need to see someone like you. Is that what you're?
Correct.
Okay.
Correct. So a naturopathic physician, we're trained as a primary care physician.
Good.
So that means that we can handle pretty much everything. We oftentimes refer, several of us are specialized. So my specialization is in oncology. So I take care of patients with cancer. I started off with endocrinology, so thyroid, diabetes, those type of things, and then morphed into more of treating more people with cancer. You can see a naturopathic physician standalone, or you can see a naturopathic physician with your other primary care physicians. I tend to always tell my patients that you should have a team around you. Yeah. Build your healthcare team. You should have multiple physicians looking at you. Why not? And they should all play well in the sandbox together, because the goal should be you, the patient. Right? So they should want to collaborate with the other doctors that you've put on your healthcare team. I think that the difference in the way that the naturopathic physician is going to treat you versus the way that maybe a traditional doc that's trained traditionally, we have lots that are in the MD-DO world that are now having more of an idea of treating holistically. So that's really nice that that's coming along. But traditionally, a naturopathic physician follows 6 principles. So those 6 principles are: 1, to do no harm. Okay, so that's the least invasive method possible. 2 is the healing power of nature. So that's vis medicatrix naturae, which is the vital force. Your body has a natural ability to heal itself. It's God-given, and it wants to be in balance or homeostasis. So it tends to try very hard to heal itself. That's why you mount a fever. Okay. Right. So the third thing is to identify and treat the cause. That's why you always hear naturopathic physicians say, well, we got to get to the root cause of that. When somebody comes in with a headache could be several different things. A headache could be you fell and bumped your head, and that's why you have a headache, right? A headache could be chemical sensitivities, that you smell something and you are sensitive to it, so it gave you a headache. A headache could be food-related sensitivities, like blood type B. When they eat chicken, they oftentimes get migraines. Okay. Right. So we have to get to the root cause. Your cause may not be somebody else's cause, right? So that's the third principle. Okay. The fourth principle is the physician as teacher, which is docere, which is doctor in Latin. This is my favorite principle. Like, I think we just need to go back to the basics of the doctor is supposed to teach you about your body. Teach you about how your body ticks and how it works. That's what we went to school for. So us telling you to do this X, Y, and Z, that doesn't help you. That doesn't help you. We need to teach you about it. So doctor is teacher is one of the principles. And then to treat the whole person is the fifth one, which is body, mind, and spirit. And this is really key, especially right now. So a lot of my patients have anxiety and depression from being in the house for so long. And mental effects, mental issues actually cause physical effects.
Oh, yes, they do.
So we have to treat the whole person. You have to really get in there and dive deep into why is this happening, right? And then the sixth thing is prevention. So this is where we start oftentimes. So that's the best cure. Prevention is the best cure, right? So those are the 6 principles that we actually we take with every single patient.
Well, I like getting to the root of things because and that was a perfect example about getting a headache and the different causes. Don't just tell me to take Tylenol. Don't just tell me to take Motrin and go lay down and turn the lights off, because that does not get down to the root of it. It just suppresses the symptoms. And that doesn't help me, because then I'm going to repeat it because I don't know what caused it, and I'm going to be a serial Tylenol taker. So thank you for explaining that. Now, in this world of COVID-19, right, everyone's so worried about getting it. And then there are people who've tested COVID-19 positive, and they want to do everything they can to boost their immune system to be as well as possible. And, I've seen some things on the internet. I've had some friends tell me, that they're taking these things over the counter. Instagram is notorious for having these ads pop up about what's going to, extend your life 10 years longer, COVID fighter, all these type of things. But I want you to talk to us about that. So let me just put out there, I've seen a lot of things like Cmos. What else have I seen? Drinking elderberry. Some people smoking and ingesting marijuana, vitamin D supplements and those things. I vaguely remember there was some study about vitamin D and COVID-19. And so all of these things, but nevertheless, you're seeing people take these products because they are hoping that it's going to help boost their immune system. Is there any truth that these products actually do boost your immune system? And what do we need to be concerned about, though? Are they safe? So let us know.
So if we're talking specifically about COVID-19, there are several that are actually really, really good, believe it or not.
Go ahead, get
that
your
actually
notes out,
have studies on them. Right.
Okay.
So when you're hearing about COVID-19 patients that test positive, and oftentimes you'll hear that they have lost their sense of taste and smell. This is classic for a zinc deficiency. So you automatically, zinc is absolutely wonderful for boosting your immune system. It actually protects your upper respiratory system. And that's part of what we're seeing in COVID-19, right? So it also boosts your immune system. It's effective, we know, specifically against coronavirus. Remember, COVID-19 is in that family. Melatonin is fantastic specifically for COVID-19 because the same inflammasome that COVID-19 specifically is, which is NLRP3, melatonin decreases it. It's and the cytokines that it has as well. So it's actually been studied, and it's doing really well in the studies. It helps to decrease inflammation. And we know that kids automatically have high amounts of melatonin, whereas the elderly have low amounts of melatonin. So this would make sense, right? So we know that the elderly are more susceptible and that kids are not, we're seeing COVID in kids, but they're not as affected as the elderly. But that might make sense because elderly don't have a lot of melatonin. It decreases as we age, right?
That's good to know.
Giving melatonin is really effective. Elderberry, y'all, I love me some elderberry. I prescribe elderberry all the time.
Oh, good.
There is so much research on elderberry. It's fantastic. It's antiviral, antibacterial, it's anti-inflammatory. It's one of those
everything. Yes.
Anti-everything. And it's got in vitro research behind it. It does increase cytokines, and this is the reason why it's effective. So when COVID-19 first came out, we were pushing elderberry. But what we have seen is we might want to back off on that slightly. If you're showing symptoms of COVID-19 specifically, and especially if you've tested positive, I would take my patient off of the elderberry.
Okay, so
I would
after you've been diagnosed with COVID-19, pause on the elderberry.
Pause on the elderberry for a second. Yeah. So vitamin D, just like melatonin, has been researched, and it decreases that inflammasome NLRP3, and it also has cytokine reactivity. So it can also raise that cytokine. So same thing with elderberry, where we think that that's fantastic for boosting your immune system and everything like that. If you're showing signs or testing positive, we're going to take you off the vitamin D.
Okay. Let me ask real quick, Dr. Sam. The cytokines that you're talking about, so an increase of them could do what? So for people who are listening, we want to know what can happen.
Perfect. So cytokines are your troopers. They're the sergeants that come in and they say, hey, I need for you guys to go fight this infection. So we want cytokines. That's part of our immune system. However, what we're seeing with coronavirus, specifically COVID-19, is something called a cytokine storm. Gotcha. Okay. It's where they come in full force and nothing's there to regulate it. So there's like this big inflammation. We can go into that. The reason why that might be happening is because your T regulator cells from your gut are not actually going to go check that. So that's a whole nother discussion where your gut is 80% of your immune system. So if your gut health isn't on point, then you're going to have a hard time regulating cytokine reactions.
Well, that makes a lot of sense because, with COVID-19, we were seeing shortness of breath, fatigue, fever, those type of things. And then later it developed into GI issues. So if you're saying that our gut health is about 80% of it, it makes sense why we're bubble guts and all the other stuff is happening when we're sick. Okay.
Yes. I got two more for you.
Okay. Bring it. Let's hear
two more.
It.
So vitamin C, I think everybody knows that. And I think that that's like the doctor's secret. Like we all keep vitamin C in our cabinets. And like when we're sick, we're like, okay, we're just going to boost our vitamin C. But the way in which you boost your vitamin C in a naturopathic perspective might be a little bit different. So I'd like to share that little secret with your viewers. The secret is, I'm going to give you the tea. So the tea is that the vitamin C needs to be to bowel tolerance. So bowel tolerance is where you're going to take a dose of vitamin C, and if you don't have bubble guts or diarrhea, then you're going to take a double dose the next day, and then you keep increasing the dose until you actually have some GI issues or diarrhea. Then you back down one dose. That's how much your body needs. It's a customized dose specifically for you, and it's different for everybody.
So we need to take vitamin C until we borderline bubble guts. That's how we know we have enough vitamin. How many oranges is that? Are we talking pills here?
Oh, girl, you can't drink it. You can't.
Or can I drink enough orange juice? Or so it probably no.
So when I'm talking about vitamin C to bowel tolerance, we're talking about grams. Like this is a high dose amount of vitamin C. This is what I'm giving my cancer patients, patients with cancer. And then vitamin A is the little known secret also that I think that's being overlooked specifically for COVID-19, because vitamin A actually protects your mucous membranes. And we know that it's all about the lungs and that shortness of breath. So vitamin A is huge when it comes to COVID-19.
So I would just find a supplement because, I mean, if you ask me right now what foods have vitamin A, I'm like, I'd have to Google it.
Carrots.
Oh, carrots. Oh, so orange things with orange. Like a sweet potato?
Yes. Yes.
Okay, listen. There you go. I must be covered already then. Yeah, orange things. Sweet potatoes, carrots.
There you go.
There you go. Okay, great. So we had zinc, we had melatonin, we had elderberry, vitamin D, vitamin C, and vitamin A. So those are the things that can naturally help boost our immune system, especially and specifically with to prepare us to hopefully not get COVID. And then I also want to make a point, guys. You heard what Dr. Sam said. If you're taking elderberry or what was the other one?
Vitamin D.
Vitamin D, elderberry and vitamin D. If you test positive, you need to pause with taking those things because of the cytokine storm that they can that can result from that. So that's some good tips. Now let me just throw one other thing in the mix because I've seen this a lot. Cmos.
Yes.
And I'll just say this. I've not had Cmos. But I've seen people taking it, and I've seen it being sold on, social media and stuff. I'm a little leery of it, but can you tell us a little, can Cmos actually boost our immune system?
Yeah, it can actually. So
Okay.
Cmos is one of those, like, it has everything in it. It's got all the micronutrients. It's
Okay.
got fiber. It's just really, really dense and nutritious.
Okay.
It's got your folate. It's got your potassium. It's got vitamin D. It's got magnesium. It's got your omega-3s. Like, it's just really, really good. And two of the things that it has a lot of is iodine and iron. So if you're suffering with low thyroid function or you're feeling fatigue and whatnot, Cmos is a great thing for you. It helps your digestion because it's got mucilaginous properties. It makes it flow through your colon better.
Oh,
So,
that's
and
what I
we
need.
know
Keep it
that,
smooth.
yes, it keeps it smooth. And we know that if you're built up, you've got built up toxins. So you literally have to get the out,
Yes.
right?
Oh,
So
yes,
that's
literally.
CMOS helps a lot with that. It's also actually an alkalinizing food. And we know that when our body is acidic, it allows for inflammation, viruses, and bacteria. So this is it's really considered a superfood. So it's really great. However, I'm going to caution that some people have iodine allergies.
Yes.
Like the dye and stuff like that. So you do not want to eat CMOS if you've got an iodine allergy. Also, I'm going to caution you if you have hyperthyroid symptoms. So high, where you are losing weight, you're sweating, you're jittery, that kind of stuff, and you haven't been checked by a physician, because this is going to raise your thyroid levels.
Gotcha.
So it needs to be cautioned. When you're having an allergic reaction to CMOS or something that has iodine in it, you're going to see burning, reddening of the skin, nausea, vomiting, irritated skin, that kind of stuff. So just caution, if you already know you have thyroid issues, even hypothyroid, I wouldn't probably do it, only because you can raise it too high.
Gotcha. Now with that iodine, so seafood allergies, would you throw that in the bucket too? If you have seafood allergies, absolutely, pass on the CMOS?
So I used to have seafood allergies until I was 32 years old. I don't think I had an iodine allergy, but I would caution people with seafood allergies with eating CMOS, honestly.
Better safe than sorry.
Just be safe. Yeah.
Yes. And then obviously many states now, medicinal and recreational marijuana is available, and we have, our gummies, our brownies, you can still smoke it. And people are claiming that, that ingesting or smoking marijuana can also help boost your immune system to offset COVID-19. What do you say to that?
So you have to remember that marijuana is actually an herb, right?
Yes.
Herbs are medicinal. So marijuana actually has two components. It's got the THC and it has the CBD, the cannabidiol properties of it.
Yes, CBD.
So we really think of like the THC part of it for pain, and the cannabidiol more for like the brain stuff. But in my opinion and in my experience, they both have components of each. And the reason why is because it affects what's called the endocannabinoid system. And the endocannabinoid system is beautiful. It is a network of flowing highways throughout every single system in our body. It touches our neurotransmitters, it touches our organs, it touches our pain receptors. It's just really fantastic. So I really actually like marijuana and CBD for quite a few things. However, some people can have a reaction to it and have a psychogenic reaction to it. So I definitely think that you kind of need to be under the care of a physician when you're doing that.
Yes. And please be careful, because I don't want to see you in my emergency room all, spazzed out because you ate 2 or 3 brownies. No, listen, they're like, I ate the brownie and didn't do anything. So they ate more brownie, and then they ate more brownie. No. And then it hit them like a ton of bricks at one time, and it was just way too much. So everything in moderation, guys. And also I will say, I want to be mindful, because I want everybody saying, and Nurse Alice was promoting this, there are certain states where it's legal. Okay. I don't want anybody to go to jail.
Right.
I want you to be healthy, but don't go to jail. And don't say that Dr. Sam and Nurse Alice told me to take it.
Don't put my name in that.
Listen,
Don't put my name in that.
I do not want to be subpoenaed to your court case. Okay.
Don't put my name in that.
Exactly. Okay. So now let me ask this. So, So I know you talked more about the elderberry and the vitamin D and the cytokine storms. Are there any of these things that could complicate some of our, and I hate to even say traditional medications, but because heart disease is so prevalent, because diabetes is so prevalent, so kind of our traditional blood pressure medications or diabetes medications, is there any particular ones that you know for could say, like, if you take metoprolol, for example, you should not take this because of an interaction, or if you're on Coumadin, don't take this because it'll increase your chances of bleeding. Are there any things like that that people should know about?
So more of, I think that I normally come from the standpoint of, if you're taking certain things, they might deplete the vitamins, right? So you would want to add extra vitamins in. For example, when you're taking metformin, like for diabetes,
Yes.
it depletes your B12 levels. So, and that causes that neuropathy that you see with a lot of diabetic patients. So that you would want to do. If you're taking statin drugs, oftentimes it depletes CoQ10 levels, and that's why you see the rhabdomyolysis. So we want to increase the CoQ10 levels. As far as CMOS, remember I said that it can cause an increase in your thyroid, which also affects your heart.
Yes.
So I would definitely caution, if you have cardiac conditions with Cmos, so you need to talk to your cardiologist before starting that.
Okay.
You definitely need to be monitored. Elderberry really doesn't have any side effects. The only thing with elderberry is that you don't want to eat the bark, the leaves, or the unripened berries, because it has a component that is cyanide in it.
Ooh.
But when you are processing it and you are cooking the berries correctly, like commercial stuff, you shouldn't have a problem with that at all. Vitamin D in too much of a high dose really doesn't have anything. Vitamin C, just the digestive stuff that I told you about.
Gotcha.
Vitamin A can cause a really, really bad headache if you take too much of it.
Okay.
Listen
Listen to your body. You gotta listen to your body.
Yeah,
with these
yeah,
things.
yeah, absolutely. So no, I don't think any of them have a real side effect. I would say that, I always say that you need to be under the care of a physician that actually knows the drug and the actual supplement that you're taking, if it's a supplement. I mean, there's many things that you can do without popping a pill to help boost your immune system. So you don't have to take supplements, and you don't have to take pills and stuff like that to boost your immune system, for sure.
Okay, so first off, let me say, I need to find a naturopathic physician, or I need Dr. Sam to fly to Los Angeles to take care of me, because never, ever had I had a physician just break that down and explain it to me. Or like when I've gone to appointments with my parents when they were alive, like explain, like you did with the metformin and the B12. And I'm a nurse too. And I'm just like, and I hear Dr. Sam say it, I'm like, you know what? That's, that's, as simple as that piece of information is, how helpful that could be to someone's quality of life.
Absolutely.
Because neuropathy is, and for those of you who've experienced neuropathy, I know that can be very painful and just like misery, just miserable.
No joke.
So,
no joke.
Okay, so this has been good stuff, but now let me get to some other things that I want to talk about. So other natural things. So like Western medicine, again, usually, at least, and shout out Dr. Tal, though. He's my primary care doctor. Dr. Tal, I still love you, but you don't talk to me about these things. So I just had to I had to talk to Dr. Sam. But what's considered alternative complementary medicine. You don't have a lot of providers buy into that kind of stuff or talk to their patients about it until, they've exhausted all these traditional medical treatments. And by that time, I'm like, look, it's been a couple years. We could have done so much better sooner. But what about like the aromatherapy, acupuncture, and all those things? Are those things that we could and should be doing now, even before we have any ailments? Or, so tell us a little bit about some of those different therapies and when would be a good time to initiate.
Absolutely. So if we think back to the 6 principles that I told you about, right? I said that prevention is the best cure. And I told you that the least invasive method, right?
Yes.
So when we think about, well, at least when I think about naturopathic medicine, it's actually primary care and not alternative, whereas your conventional medicine and your surgery and your synthetic drugs, that should be alternative medicine.
Yeah, that's failing anyways. It's expensive.
So we try these things first, and if they don't work and your body still needs a little oomph, then we move up what we call the therapeutic order, which is a triangle that we follow, right? So we have foundations, and then we move up the pyramid, as we call it. It's a therapeutic order that naturopathic physicians follow.
So there are levels to this, y'all. Levels,
we got
okay?
levels. We got levels.
Level up,
So,
level up, level up, level up.
there are so many other things that you can do. So sleep, hydration, food as medicine, homeopathy, acupuncture, IVs, herbal medicine, all those different things are things that you can do right now. You don't have to wait until you're sick. I suggest you try them out and do them while you're well, so that you are doing the prevention, right? First, do no harm. So homeopathy, for those that don't know what homeopathy is, it's usually a dilute substance that's in a very small little sugar or lactose pill. And one of the really popular ones is called arnica. It's kind of like an aspirin, but it's really when you're feeling like a hurt that has a bruising feeling. So arnica works really well sublingual, or you can have arnica gel or cream on your sites. So I often use it for my patients pre-surgery and post-surgery. So arnica is fantastic for that. There's other homeopathics that I use well, but that's one that I feel is really safe without me prescribing it right now.
I like that one. And you know what? I've heard of it. And obviously, as a nurse working in a variety of different clinical areas, I've seen a lot of surgeons, especially cosmetic surgeons, using arnica and actually having people take arnica prior to their surgery. But I've never seen arnica anywhere when it came to other, like, cardiac bypass or like those other other medical, or having surgery to fix or correct something. It's usually been on the opposite spectrum when people are having elective procedures. But being pain-free, having a better quality of life, healing better should not be elective. To me, it sounds like it should be incorporated in other things. So this is good stuff. I'm glad, because also we have also health professionals that listen to this podcast too. So listen here, y'all. If y'all don't have arnica in your surgical what you call that protocol, you might need to add the little box so you can check it too. Anyways, go ahead. What else we got, Dr. Sam?
So true story about homeopathy. So my son was born with brachial plexus, which is a nerve damage to the arm, and he had to have surgery when he was 6 months old. And we went to Shriners, and they were very, very kind in the fact that I was like, no, he has to have these homeopathics, and I need to come into the recovery room, and I need to give him the 3 homeopathics afterwards, right? So the 3 homeopathics, one of which is arnica, right? And the other 2 are really to help decrease the load of the anesthesia and also to help with trauma. Okay. So they said that my son he woke up smiling. They said that nobody had ever done that before in surgery so little. So they now have it as part of their protocol.
Oh, what is it? What you got?
It worked really well. So it is phosphorus, arnica, and it's an S. I don't know. I think it's Staph Sagaria, but I have to check on that one for you. But there's 3, and I always use it pre and post surgical procedures. I don't care what it is. So if you're getting a mastectomy, a lumpectomy, whatever surgery it is, it's pre and post. And there's some other things that we add in there to boost your immune system before surgery. But those are the 3 homeopathics.
Oh yes. I'm gonna get that from you to make sure we put that in the show notes, guys. So if you're going for surgery, or you know someone who's going for surgery, I mean, you just heard Dr. Sam's testimony, and she's not just a provider trying to push this on you. I mean, her own very son, and he woke up smiling. I don't know anybody who wakes up smiling after surgery, but I want to wake up, if I have to have surgery, I want to wake up smiling, because that means I feel better. So she's going to share that with us. Yeah, that's amazing. Okay.
So acupuncture is a way to balance your energy by removing blockages. And the way in which I explain acupuncture, because I actually do acupuncture on my patients. Not all naturopathic physicians are trained in acupuncture, but the school that I went to is year round, because we take acupuncture while we're in school. So acupuncture, if you think of a nice stream that flows through and you have a boulder in the stream, it's going to create an ebb flow, like it's going to go around the boulder. So acupuncture gently removes the boulder so that you've got a nice energy flow.
Ooh,
Basically,
I love
is
it.
what it is.
I love
So
that
it's beautiful.
energy.
It is. The needles are, I know that they're needles, but
They're tiny.
they're
Tiny.
tiny. They're super tiny.
Yes.
And they don't hurt. And right now, my new thing is auricular. I've always liked auricular acupuncture. That's acupuncture in your ear, because every organ system is actually in your ear. So you know how people get reflexology on their feet?
Yes.
It's the same with the ear. And so you can put little seeds and you just press on the seeds.
Wow.
And I suggest everybody do an ear massage every single morning. It wakes up all of your organs are in your ear. They've got like, the neurotransmitters that go through your brain, and then it goes to your spinal cord and it goes straight to that organ system, right? So give yourself an ear massage every single morning.
Or give your boo an ear massage if you love them. I mean, just go ahead.
Yes. Yeah.
Boo, let me massage them ears.
Hydrotherapy is water therapy. And this is huge in other countries. In Europe and Asia, hydrotherapy is part of daily life. They have what are called sanatoriums. They're where you just do nothing but sit in the water. So specifically hot and cold contrast is what I'm talking about. So you'll sit in a hot tub for a little while, and then you'll sit in, and then you'll do what's called a cold plunge. This actually increases the circulation and blood flow.
Ah, this is what those athletes do when they get in those ice tubs after a game or after some intensive training.
There you go. So for my patients, pretty much every single patient is told to do what's called a contrast hydrotherapy shower. So anytime you're in the shower, you're going to suds up with the hot water, and then you're going to rinse in a cold blast.
Oh.
I like to do it 3 times. But if you can only do it once, that's fine. But you're increasing your blood flow. You are increasing circulation. You increase your ATP. And it's just an overall easy, cheap, free thing for you to do. That's super important for your health.
So Dr. Sam, is this something that I could do every day? I could do this hydrotherapy?
I've been doing it for as soon as I heard about it in school. So I've probably been doing it for 20 years.
Listen, you don't look a day over 21. Stop playing.
I've been doing it for 20 years.
She's the youngest doctor. Look, all this experience, and she's only 21. She looks amazing. But look, she looks amazing because she does all this stuff. Shoot, I'm trying to be like Dr. Sam. Dr. Sam goals. So Dr. Sam, and I wish, we're going to definitely have to bring you back on the show, but this has been some great starter things. As we're wrapping up, any other things that you want people to know specifically that maybe we didn't get to earlier? And then also, where can people find you and learn more about this? So where can we find you? Tell us a little more.
So you can find me at drsamnd.com. So that's DRSAMM. N is in naturopathic, D is in doctor.com. And I have a webinar coming up. It's on August the 29th. Mm-hmm. It is the 7 secrets to transform your health and boost your immunity.
Oh, okay.
And you guys can text 855 639 0646, and you're going to text message and say Nurse Alice.
Hey. Yes.
NURSEALICE to 855 639 0646, and this webinar is free.
Oh, listen, y'all. You guys just got a gift. That is a major gift. I mean,
that's for y'all.
I mean, this has already been tons of great information, a lot of practical things that you can do day to day to boost your immune system. Now, not only did we talk about things that you can take, we talked about hydrotherapy. She talked to us about acupuncture and the importance of that. And you're going to get a free entrance into Dr. Sam's program. Come on now. Come on now. Listen, all the tea, no copay, plus some goodies in there. I love it. And you guys, please follow Dr. Sam. She is amazing. We're going to definitely have to bring her on. She's going to have to be our resident naturopathic physician, because listen, I don't know about you, but I have not had a physician talk to me in this way and give me these bite-sized tidbit pieces of information that I can actually apply. And that makes sense. Makes sense. Look, I'm going to tell all my diabetic patients now, like, look, okay, how's our B12? How's our B12? We got to make sure, because I don't want anybody having
Yes.
uncomfort. So, okay, friends, this has been another great episode of Ask Nurse Alice. We've had Dr. Sam. We've got tons of information. I'm going to make sure in the show notes that we include Dr. Sam's information. Again, more information about how to register for her event using the promo code Nurse Alice. I'm also going to make sure that we list those 3 things for the pre and post op. So we're going to make sure that we get those for you. So again, you guys, follow Dr. Sam, follow the show, go to your favorite podcast network and subscribe, like, follow, comment, and you know what? Share the podcast with someone else, because sharing is caring. And so until next time, guys, make good choices, love one another, wear your mask and wash your hands, and be safe. Bye, guys.
This has been an Inclusive Media Podcast Studios production.